Hi, everybody. Welcome back. In this particular lesson, we're going to talk about group therapy and the various theoretical orientations you could take. Now, if you're following the chapters, this is chapter 4 of Corey and Corey's book, where they talk about theories and techniques. So here we go. So in terms of learning objectives for today's particular lesson, I'm going to provide you a general framework for theories and apply it to practice. We're going to understand how techniques are associated with each theory. We're going to consider ways of viewing groups through multicultural lenses. We're going to understand foundations of group work. We're going to talk about psychoanalytic approaches and psychodynamic approaches, Adlerian approaches. We're going to talk about the various key concepts and techniques of experiential and relationship-oriented approaches to group work. We'll talk about behavioral approaches, postmodern approaches, and talk about integration. So that is the roadmap for today. Now, theory. What is a theory in general? A theory is a general set of principles that guides one's beliefs and actions. So when we think of a theory, it can guide you as much as a roadmap does or a navigational instrument does. It also provides you a set of directions where you are at the starting point. So that would be when your clients come in. Where you hope to be at the end point, what, if all the goals were accomplished, what it would look like, and various steps along the way. These would be the interventions you use. Now, it's very important to understand that with every plan, you need to be flexible and modify the way you approach things if you're going to accomplish your goals, because not every technique works with every person. So you want to have a flexible roadmap. Now, it's important to also talk about an integrative approach to group practice. Now, when we say an integrative approach, that's when you put pieces of different theories together and apply them. Now, most therapists, if you were to ask them, well, what is your theoretical orientation? If you were to ask a therapist, they might say, well, I'm a psychoanalytic practitioner. I'm a cognitive behavioral practitioner. I'm an existentialist, whatever it might be the answer. But we know our theoretical orientation. Now, if you were to ask me, I would actually say that I am more eclectic, where I engage in a theoretical integration of 3 different orientations. So I benefit very much from cognitive behavioral therapy. That is the heart of the approach that I take, exploring thoughts and feelings and reorganizing thoughts and modifying behavior that way. I also view myself from a humanistic or existential lens, trying to believe in the best in people, helping people to reach their potential and achieve their life goals, explore purpose in life, things of that nature. However, I also view myself as a psychodynamic practitioner to some degree as well, because I find that early childhood experiences shape who we are and shape our relationships. So when it comes to attachment and early childhood experience, I put a lot of emphasis on the psychodynamic principles. Now, as I say this, I have considered my own personality, who I am, my own worldview, and you should do the same when you're thinking about, well, what theoretical orientation best fits me. Think about your personality, think about your unique strengths and your life experience and the worldview that you have. And there will be a series of techniques that work best for you. Now, there are different ways to achieve integration. There's technical integration, and then there's theoretical integration. And I'm going to define both of these. Technical integration is basically taking techniques from each orientation or theoretical model, but not coming to a holistic theoretical orientation, right? So you're just taking certain thought work exercises from CBT, but not figuring out how that might work into a larger framework. When you talk about a theoretical integration, which is more of an eclectic approach, you come up with a new theoretical approach that's unique to yourself. And it blends and synthesizes the multiple orientations that you align with in a way that you can engage in successful and functional therapy. So we pay attention to three domains. The cognitive domain, this refers to how you think. And if we were to explore one's thoughts, we will see very commonly we have faulty thinking. And there are a whole host of irrational beliefs or faulty thinking. Something like catastrophizing is a maladaptive thought process or faulty thinking where a person thinks the worst is always going to happen. So that would be an example. As it relates to the affective domain is about emotions and feelings. So we want to explore how you're feeling. Now, I have seen that sometimes one's emotions are misaligned with their thoughts. So you have to work with your clients or your group members to explore where their thoughts and emotions might not be in alignment. Or another strategy is intellectualization, where instead of talking about emotions, people talk in a very heady, logical way so that they don't have to explore their feelings. So in group therapy, you want to listen to how people are sharing their experience, because if they're overly intellectualizing, you might ask them, can we go a layer deeper? Can we explore an emotion that goes with that thought, so that you're getting a more complete picture of their experience? And then the behavioral domain is what you're actually doing. And once again, our thoughts and our actions could be misaligned. And there's a concept called cognitive dissonance. And cognitive dissonance is when either our thoughts and behaviors are misaligned, where we believe one thing, but we're not acting in accordance with our values, or where we have two competing values, where we believe both of them, but they're not in accordance with one another. So that's going to create some conflict or tension, which is going to require some resolution. And in therapy, we can use our techniques to tap into that and get people to realign their thoughts, emotions, and beliefs. So I already said this, but just as a reminder, an integrative conceptual approach includes the three domains we talked about. And I define technical eclecticism, which is taking techniques from different models, where a theoretical integration is more of a synthesis, a blending, where you create your own orientation that has the fullness of each of the components. So when we use group techniques effectively, our techniques are leader-based interventions. that are aimed at facilitating movement within a group. So if you are a group leader, you should be thinking about facilitating growth and movement. That's going to be crucial. And as we talk about the various stages of group, it's possible for groups to stagnate. And we're going to talk about a non-working group, how you get stuck. And one of the reasons why you might have a non-working group is the group leader is not really thinking about how to facilitate that movement within the group. And we're going to talk about specific techniques, but virtually anything the group leader does could be a technique. So self-disclosure. If the group leader speaks about their personal experience, well, that actually could be used as a technique to model what you expect from other group members. Whereas from certain theoretical orientations, you want to be a reflecting pool, reflecting back their experience, but sharing very little. So you have to think about what you're going to do, what you're not going to do, how much to share. All of these could be techniques. The group leader's body language and nonverbals. This is something you're doing. You may not be attending to it, but if you make a side eye where you look at someone as if you're like, what did you say? And someone catches that, they're going to perceive you as being judgmental. And when we talk about techniques, they're very useful when they evolve from the work of the group participants, and they're specific or tailored to the situations that come from the group meeting. So long story short is that in some group approaches, you have a strategy, a pre-group meeting. You might meet with a co-facilitator and say, here, this is what we're going to do. But sometimes things can happen inside the room, the treatment room, that's a game changer. And the best techniques are the ones that are flexible and adaptive to the experiences of the members of the group. So make sure you're being fully present during the group experience. Now, in selecting techniques, you want to think about the purpose and a type of group. Not every technique is going to be as useful for each group. For example, if you're dealing with people who have limited insight, you're not going to do a lot of the deep thought work. You might focus on the concrete expression of what they're experiencing in the moment and not rely on thought work or the insight-driven therapy or techniques. You also want to not treat the group as one whole. You want to be mindful of each of the group members and where they are in the group process. And you want to assess the readiness for that member to talk about whatever you're probing or deal with their concerns, because you want to push a little bit beyond one's comfort zone, but you don't want to pressure people to say or do things they don't want to do. Now, I had a mentor who told me growth comes from uncomfortable places. And if you're feeling comfortable in therapy, then you're probably not doing therapy, right? Because therapy involves challenging people to become better people or achieve a goal. And if you have plateaued, that's a concern. So you do want to push people a little bit beyond their comfort zone, but you also want to provide space for the individual to say, I don't want to go there. And every person has the right to share or not share in group. And if you see a person had a reaction and you call on them and they say, I'm not comfortable sharing, that's fine. You might scale back and say, well, if you don't feel like sharing everything that's going on, can you share how you're feeling now? Just an emotion around it. So you provide them space to get somewhat of a catharsis or a release, but don't push them to a point where they're disclosing beyond their comfort zone. You also want to pay attention to cultural background and value systems and their value systems. Pardon me. Uh, it's interesting that when people come to therapy, they bring their culture with them, of course. And I did a demo on culture and cultural identities in a previous lecture. But it's important to know that, for example, many Asian cultures will treat you similar to a medical doctor. You are the doctor, you are the authority, and they will want you to tell them exactly what they should do. And that seems to be against some of our rules where we help guide people, but they come to decisions on their own. But knowing what's culturally appropriate is going to be useful, knowing your authority. Now, there's a flip side to that, that treating uh, mental health professionals like medical doctors, they assume you're going to fix them relatively quickly. So if there isn't significant change quickly, it's possible for you to lose members of especially East Asian communities. So be mindful of the cultural background and their value systems. Another example might be if you're working with the Latinx community. One of the hallmark features of the Latinx community is family, and the overarching importance of family. And when I say family, I'm not talking about the nuclear family. I'm talking about a more extended family that includes grandparents and aunts and uncles, and having a multi-generational household is important, and respecting the grandparents as matriarchs or patriarchs is going to be very important. So these are just examples. I'm not covering everything in great detail, but understanding cultural backgrounds is going to guide things. And we'll talk about feminist group therapy, and I might bring back the case of Latinx community and how males are considered more of an authority at times, and there's machismo and the importance of a man being masculine and being the dominant head of the household, and there could be problems that come from that, or women having to tend to the children or do more of the domestic stuff. These are built into cultural value systems that you need to be mindful of when you're working in a group. Now, you are going to be as successful as the level of trust your members have in you. So as a group leader, if your group members trust you, they are going to disclose, they're going to take risks, and ultimately they're going to grow. But if your group members don't trust you, then they are going to keep it very, very superficial, very shallow, and the deep insights that you're trying to accomplish or the meaningful growth that you're trying to accomplish might be undermined by the lack of trust. Also, you want to think about the level of cohesion among the members of the group and the trust that they have with one another. Now, group cohesion means that they're fused together and feel some interconnectivity with each other and a shared responsibility for one another, and they're bonded. They're bonded with one another. So the greater level of group cohesion you have, the more gains you're going to have in the group process. So long story short is you have a lot to think about when selecting techniques in group therapy. Now, viewing groups through a multicultural lens, it's very, very important to consider all dimensions of one's identity. Regardless of your theoretical orientation, it does not matter, because that which is salient now may not be salient later, and something you thought wasn't important could come up as important later. So pay attention to all the domains of identity. And we did that exercise on identity, and the various layers of cultural identity. You don't have one identity, you have many identities. So you have to pay attention to that. You also have to understand that you have power as a leader. You're in a position of authority, and people are going to view you that way. So be careful how you use the power that's bestowed upon you. Now, I personally view the process of group therapy as, you give me the power in the beginning, but as soon as we start, I give it right back to you. I don't need to possess the power. I think that you will feel safer when there's a shared power and there's more of a view of egalitarianism or equality amongst the members and the group leader. So be mindful, though, because you are a doctor or a future doctor or a future licensed professional, and they're going to view you as the expert, and don't abuse that. Now, you also can possibly symbolize structures of oppression for some members. And it's, for example, as a Jewish individual with a yarmulke, if I were running a group with Middle Eastern clients, it is possible that one could conflate my Jewish identity with support for Israel. And then one could see that as a level of oppression against other members of the group. Or as a male, I might symbolize certain aspects of structural oppression against women, right? Because there, as much as we're making progress, there still seems to be a glass ceiling. And I know in her concession speech in 2016, Hillary Clinton said, we made a crack in the ceiling, which is a good thing. That means that there's been progress, but there still is a glass ceiling, right? So we have to be mindful of what it means to be male in the room when running groups related to women's issues. So, and it goes on and on and on. So we might symbolize something in our group members, or being white. What does it mean to be white in a group that is largely ethnic minority, right? So I could go on and on and on, but it's very important to have these conversations safely with group members. And it's okay to hear from your group members that, you know, your perspective, you won't get it because you're white. Now that sounds potentially shocking, but no. Ken Hardy, which is a great professor at Drexel University, he talks about this all the time. It's all about your vantage point. I've never lived in the skin of a non-white individual, so I can't possibly fully get the experience of Black individuals and persons of color. That's important for me to understand when I go in there. And it's okay to have conversations around oppression. For example, I bring the elephant into the room and talk about it. So if I were doing a group with survivors or victims of domestic violence, and the group happened to be all female, I might ask, what does it mean to you that I'm a male leading this group? How does that make you feel? And does anyone feel a sense of lack of safety? And that creates a dialogue, and it allows people to talk about their experiences that they've had with oppression or discrimination, because you bring your identity in a room, other people bring their identity into the room, and it's important to be sensitive as well as have a sense of cultural humility to hear the criticisms that people have about you or the symbol that you represent in their life. Because there are many times that you may not actually be that person, but you're a symbol of all that was wrong in that person's life. All right. So now let's start to talk about the relationship between theory and techniques. So if we were to go through some of the theories or psychodynamic theories, there's a focus on stressing insight, experiential and relationship-oriented approaches focus on your feelings as well as your subjective experience. Cognitive behavioral approaches focus on how you think and what you're doing and whether your thoughts and actions are aligned. And then we'll talk about a whole host of postmodern approaches that stress understanding the subjective world we live in and tapping into whatever resources we can for change within the individual. So let's start with psychoanalytic therapy. It's very important to understand that psychoanalytic therapy goes all the way back to Freud. Now, I could ask you, well, what's your perspective on Freud and his theories? But that is not relevant, because in the end, Freud said a lot of things that were really useful for therapy. So the emphasis on insight, or exploring the unconscious, or reorganizing one's personality structure, all of these are useful. Now, when we talk from a psychoanalytic point of view, many times these groups go on for long periods of time. So it's not necessarily short-term solution-focused therapy. You can be in group therapy for years. But what I will tell you about psychoanalytic or psychodynamic approaches to group therapy, the richness and depth of your experience and learning about yourself and learning about relationships with one's parents and how that shaped your attachment, your identity, and how you interact with your romantic partners and friends, it's powerful. So one of the challenges to psychoanalytic therapy, though, is it's very costly, very expensive, because it goes on and on. Now, one belief is that your early childhood experience shapes who you are. So we focus on, your first 6 years of life and, how things went with the family, whether there were any traumas or whether there are any conflicts. And we explore that, right? So the goal of psychoanalytic therapy is to make the unconscious conscious, bring things from beneath the surface to the forefront so that you can look at them and possibly work on restructuring personality. And when you restructure personality, there is a sense of release and relief that comes from that. Now, psychoanalytic therapy, I have to tell you that there's a difference between early psychoanalytic models that come from Freud and psychodynamic approaches, which are more modern approach. So the more contemporary formulation is much more useful today, shall we say. So we focus on therapeutic alliance. The therapist is not just a reflecting pool, they're in the room with you. You still use an analytic framework, right? So the id, ego, superego. You still use free association, which is saying whatever comes to mind and exploring that. We still use interpretation and dream analysis, although dream analysis is done somewhat differently today. There is still an exploration of resistance and transference. All of these were pieces of the Freudian puzzle that were carried on by many psychodynamic therapists. Now, so when we talk about psychodynamic group therapy, we want to explore transference and countertransference in the current group situation. Now, what is transference? Transference is when a member of the group superimposes feelings that they might have for another person, whether it be their parents or their boss or whatever, and they superimpose it on you as the clinician, you as the therapist. That's transference. Now, transference can be positive, negative, or erotic. So a positive transference might be that they idealize you and you might serve a role as reparenting. A negative transference is some of the resentments that they have for someone else might be put upon you. And then an erotic transference is where the client develops sexual feelings towards you, which happens rarely, but it's something to consider. Now, that's transference. Countertransference is the opposite, where in the group situation, now it's the therapist who's superimposing their feelings or their experiences in life onto the members of the group. And once again, it could be positive, negative, or erotic. So countertransference is from the clinician onto the clients, whereas transference is from the clients or group members onto the clinician. Now, that's classic psychoanalytic, psychodynamic principles. Alfred Adler was a very special individual. He was from the psychoanalytic perspective. However, he broke off from Freud and came up with his own perspectives on therapy. And he wrote the concept called individual therapy. Now, individual therapy does not mean necessarily doing therapy one-on-one. Individual psychotherapy or individual analysis is studying the whole person. So there's a focus on the unity within the individual. There's the embracing of the subjective experience of that individual. And there's a spotlight on whatever your life goals are and how they direct your behavior. Now, another major piece of Adlerian therapy is something called the inferiority complex. Now, according to Adler, everybody has some natural inferiority. And inferiority is not a dirty word, right? In this context, inferiority is a lack of competence, but according to Adler, you engage in something called superiority striving, which is to take areas of inferiority and move towards competence and mastery. So that's superiority striving. So everybody has natural areas of inferiority, and growth comes from taking those areas of inferiority and making them areas of competence. So what is an inferiority complex? Well, an inferiority complex is when the feelings of inferiority are so extreme that they paralyze you and your sense of self-worth is impacted by that. Now, when a person has an inferiority complex, they could respond to that inferiority complex in many different ways, right? So they could quit based on their inferiority complex, or they could overcompensate in another area to demonstrate that they have competence to help them deal with their areas of inferiority. So now he also talks about style of life. Our style of life consists of our view about others, the world, and ourselves. And based on our style of life, that's going to guide our life goals and pursuits. So in an Adlerian model, he also puts a focus on the family constellation. So he pays attention to the birth order and the structure of the family. Now, one of the interesting things, according to Adler, was that he believed strongly that birth order affected your personality. Now, research suggests that birth order has a very weak correlation with personality. It's negligible, but nevertheless, he felt that the firstborn behaves in a certain way that's distinct from the middle child, which is distinct from the youngest child. So birth order played a role in personality. He also wanted to push a sense of social interest or relatedness to the world or social responsibility. Now, in a group setting, Adler believed in a more democratic approach within the group, and he didn't screen members because he felt that that interfered with democracy. Now, one could criticize that because we said in a previous lecture that if you don't pre-screen members, it's possible that you might have individuals within the group that might undermine the growth of the group as a whole, right? So they can force stagnation or conflict in a way that might not be useful. But according to Adler, he didn't believe in pre-screening in groups because it was inconsistent with democracy. Now, Adler focuses on psychoeducation, so teaching members more about symptomology, teaching members about their life goals, teaching them about inferiority, things like that. It's present to future focus, whereas the traditional psychoanalytic perspective focus on birth to six and how that affects you now. And it's relatively brief or time limited, which is very different than the traditional psychoanalytic perspective, which was long term. Now, the therapeutic relationship is based on cooperation, trust, respect, confidence, collaboration, and alignment of goals. So when you think about that, that sounds very much like a humanistic approach. And it's interesting when I think of some of the work of Abraham Maslow and Carl Rogers and compare that to Adler, some of their beliefs are not too far off, even though they're viewed as separate schools of thought. Now, Adlerians don't follow a set of procedures. Their techniques are hodgepodge, but some of the techniques include life history, lifestyle analysis, family experiences, homework assignments similar to CBT, and offering encouragement. So if I were to encapsulate, well, what did you get? What I covered right now are the psychoanalytic and psychodynamic principles. And what you got was a little flavor of Freud and his value systems and how that affects groups from a psychoanalytic point of view. You got a little bit of flavor of more contemporary psychoanalysts or psychodynamic principles. And then you got a little bit of flavor of Alfred Adler as another one of those individuals who came from the school of thought of psychoanalysis, but branched off. Now we're going to shift a little bit. We're going to shift to more experiential and relationship-oriented approaches. And we're going to start with existentialism. So existentialism, you probably have heard the word existentialism in a philosophy course, or in a history of psychology course. But existentialism focuses on things like, why are we here? And when I say here, not in the class, but on this blue marble we call Earth, right? Why are we living? What is our purpose in life? How do we make meaning or make sense of the world around us, right? These are foundational questions from an existential perspective. And so if I were to ask you, well, what is your purpose in life? You would probably look at me and say, whoa, man, that's a really heavy question you're asking. I need time to think about it. And that's okay, because in your phase of life, you're still figuring it out. Most of you are at this point in life, emerging adults or early adulthood, where you're still figuring out who you are and what you want to do with your life. And in fact, I'll give you an example of an existential crisis. Most people, before they graduate, they have a sense of anxiety. What now? Right? So many of you who are in this course, you're in a graduate program, but you're going to graduate in about a year. What are you going to do afterwards? I'm sure the question that I ask now is eliciting some anxiety from some of you who are watching this. But that is an existential question. What are you going to do with your life? How are you going to make meaning of your life? How are you going to feel like at the end of your life, it was a life well lived? Well, thinking about graduation and then the next responsibilities of life are heavy, but they're important. If you are above the age of 25, you probably have spent some time thinking about this, and you might be able to give me more of an answer off the cuff. But most of us require time to think about this. Now, the existential perspective believes that all people have the capacity for self-awareness. All people have free will. And with that free will, you have responsibility for the choices you make. So because you could say or do whatever you want, you have to own what you say, own what you do, take responsibility for your life. So responsibility and living a meaningful life are part and parcel to the existential perspective. Now, we also have a concern to preserve our uniqueness of identity. And when we interact with others, according to an existential approach, they help us better understand who we are, develop more knowledge about who we are. And also, the other members of the group are sort of checks and balances against our beliefs of the self. If I were in individual therapy, I might convince myself that I'm living in accordance with my values and I'm doing everything I'm supposed to be doing. I'm taking responsibility for my life, and the things that are going wrong in my life, I had nothing to do with the problems. Well, when you have other members in the group, they're going to push back on you and say, well, you're acting like a fly on the wall, but have you considered XYZ? Have you considered how you contribute to the continuation of your own problems? So it's nice that in a group setting, when we interact with others, we get to see how others see us, and they get to challenge us on whether or not we're living in accordance with our value system. Now, the significance of our existence and the meaning of our life is not fixed. It changes through our life. And as we accomplish one goal, we don't say, oh, I'm done, did everything I needed to do. No, what happens is we create a new goal, a new life task, and we start striving towards that goal or life task. So what we tend to see is that who we are is never fixed, and we can recreate ourselves through the projects that we take upon ourselves. Another important thing is that anxiety is normal. It's part of the human condition. From an existential point of view, anxiety is something that gets you to think about life. It's your natural alarm bells. It's supposed to happen. So when I ask you, well, what are you going to do after you graduate? If you had anxiety about that, that would be an existential anxiety. Now, another form of anxiety comes from death. So death thought accessibility or mortality salience. If I were to get people to think about the fact that they're going to die, everybody dies, that will provoke some really heavy feelings in your life. Now, there is a great book by Ernest Becker, who was he was a sociologist who wrote a book called The Denial of Death. And he talks about all the ways that because there's anxiety that comes from thinking about death, we do everything to not have to think about death. In fact, we don't even like to use the word death. If someone dies, what do we say? Oh, they passed away. They moved to the other world. We use all these different phrases not to even use the word death, because death, even though it's a basic part of the human condition, triggers anxiety. So, but it's important to understand that we understand our mortality, because that's going to put pressure for us to do things and make meaning of our life. If someone were to ask me what my greatest fear is, it's simple. My greatest fear is to die mediocre. Now, I am not considering myself a great person. I don't see that. I feel that I'm learned and I've accomplished a few things, but I don't believe I've yet reached my potential and fulfilled all my life goals. But I'm afraid to die mediocre or a life unfulfilled. So that is my deepest fear, right? For life to be cut short and not fulfill my mission. But that's normal. That's a normal thing. And I'm 40, so now I'm thinking about it more than when I was 20. When I was 20, I never thought about death. I thought about all the fun things that I wanted to do and all the traveling. But now that I'm 40, I'm like, okay, well, I have just about equal number of years in front of me as behind me. I'm at the midway point, according to lifespan theorists. So I better, press the gas so that I live a fulfilled life. Now, thinking about death could also provoke a sense of loneliness in people. So what's the goal of therapy? The main goal of therapy is to assist participants in accepting their freedom and to become the authors of their own life. We create our own destiny, and we are responsible for creating a good experience. It's interesting. I have family, and I have one family member in particular that, and I'll say they so that no one can deduce who I'm talking about, but they're always negative. And they're always looking for bad things to happen. And they're always saying all the things that they cannot do. And while they're doing that, they're giving up on living a happy life. they're yielding their power, because when they say, oh, this never works out or this is happening, well, then they quit trying to do something about it. And that's a shame, because they could live an enjoyable, happy life, but they choose not to. And I use the word choose because I want them to assume responsibility for their outcome. So if they're having problems with their kids, what are you doing about it? If they're having problems with their romantic partner, what role do you play in those problems? If they're not happy with, the amount of enjoyment in the world, well, what are you doing about it? Are you going on vacation? Are you exploring the world? Like, you have a lot of responsibility in choosing your life. So you could choose to be unhappy, or you could choose not to. Now, I wouldn't say this to them because I know that they wouldn't receive it, but you're going to see that we have free choice. And with that free choice, we are the authors of our own life, and we are responsible for that. Now, another goal is I thou relationships versus I it relationships. A goal is to connect with a person on person to person versus third person, which is impersonal. In couples therapy, sometimes there'll be a member of the couple who complains about their partner, and they're pointing out all the problems with their partner. And I usually say, well, have you looked at them and told them what you want? Right? Oftentimes it's, he never does this, she never does that. Well, that's a third person point of view. And I thou encounter is more equal, and it's more connected to the person. So an expression that I encourage in therapy is, I feel blank when you blank because blank. I feel sad when you scream because it reminds me of my childhood, let's say. So now when you do that, it's an I thou encounter. You're not saying it's the reality, you're just saying how you feel. You're connecting with it on a direct way. Now, in terms of existential therapy, once again, there's a reaction against viewing the system as well-defined integrated techniques, also a little bit hodgepodge. Now, person-centered therapy or client-centered therapy comes from Carl Rogers. And according to Carl Rogers, there are 3 cornerstones of meaningful therapy: empathy, unconditional positive regard, and authenticity, so or genuineness. So those are the 3. So I'm going to go in a different order, and I'm going to first talk about authenticity or genuineness. Being real. You gotta be real. So who has the responsibility of being real in the treatment room? Everybody. The clients have to be real. They have to be honest with what they're experiencing. And so does the therapist. Now, I say with people who I can see are not being genuine or authentic, I say, look, you're as sick as your secrets. We could spend a lot of time dancing around the issue, but is that serving you well? So being real. Now, what's nice about being authentic is that the clinician can also express their experience. So in a group therapy setting, it might not be uncommon for a group leader to say to someone who's habitually late, I feel somewhat disrespected by the fact that you're not coming on time, right? So you would be like, whoa, who gave the therapist the authority to share their emotions like that? the model does. So that's one, genuineness. Two is unconditional positive regard. Unconditional positive regard is a sense that I have to love you for who you are, as you are, with no strings attached. So I am not trying to control you. I'm not trying to mirror the world. I just love you as you are. I'm going to facilitate growth with you. I'm going to help you with self-exploration, but I'm going to accept you as you are. Now, what's interesting, according to Rogers, is that many of the problems that people experience in life is due to conditions of worth. We receive either explicit or implicit messages that we're unlovable unless we behave a certain way. And I'll give you an example. All you have to do is go to a Little League baseball game. And if you go to a Little League baseball game, you will see there are two kinds of parents at the baseball game. There's that one parent who's screaming at their kid, hit the ball, hit the ball. Well, what happens when a kid strikes out? That kid feels as if they're not loved because they didn't hit the ball. Whereas there's another kind of parent at Little League who's cheering you on. And if you strike out, that's okay, we'll get him next time. That is unconditional love, unconditional positive regard. The kid who strikes out and the parent loves them no less, and the kid hears that, that's unconditional positive regard. And in therapy, we have to express unconditional positive regard and sometimes reparent our clients and give them the love they never got. And, I have to tell you that because I'm an independent practice, I don't take on clients that I can't learn to love, because I have to care about them more than just as a 45-minute interval. I have to be happy with their successes and, struggle with their struggles. All of that is healthy. That's normal from a humanistic or a person-centered approach. And then last but not least is empathy. You have to be able to put yourself in their shoes and imagine what it must be like to be them. That, if you do these three things, you're going to bond with your clients. So the goal is to be a fully functioning, fully experiencing person. Learn to accept yourself. You decide how you change. One of the nice things about Rogerian therapy or person-centered therapy is who's the leader? Person-centered. I may be an expert in psychology, but I'm not an expert on you. So I follow your lead. So a person-centered approach allows the group members to guide the show. Now, we create safety, trust, self-exploration. We help identify areas that block growth. I already talked to you about the genuineness, warmth, empathy, unconditional acceptance. All of these are aspects of client-centered or person-centered therapy. Now, when you do person-centered therapy in a group process, it's very important to understand that you are not what caused the change. You are an instrument of change. You are a facilitator of change, but it was the group that made that happen. So the focus is more on the relationship with the group rather than a specific technique. Now, there is something called person-centered expressive arts therapy, which uses arts in group to engage in healing and self-discovery. Now let's move to Gestalt. So Gestalt is an approach that focuses on here and now, what you're experiencing, any unfinished business you have, and there is an emphasis on choice and responsibility. Now, the originators of Gestalt therapy were Fritz Perls and his wife. So they developed this model. So there is a focus on the therapist's presence, being authentic, as we said, um, gentleness, self-expression as a therapist, and building a sense of trust. Now, one technique that's not talked about from a Gestalt point of view is a skillful frustration. And that's interesting, right? So, skillful frustration is sometimes you're going to intentionally not give the client what they want to foster a greater sense of growth. For example, if you have a person who has an issue with boundaries, and they come early to session, you might intentionally not take them until their scheduled time as a sense of teaching. We start at a certain time, we end at a certain time, to teach a sense of boundaries and containment. Now, that might frustrate them, but it's done with a purpose. Now, leaders from a Gestalt point of view focus on tinkering or experimenting with things, trying to explore rather than a direct intervention. Now, we do pay attention to feelings, thought, body, sensations, and actions as pathways to understand what's going on. From a Gestalt point of view, you might ask the person, what are you feeling right now? And then you might ask them, well, where in your body are you carrying that? So those somatic experiences tell a story, especially with trauma. Somatic experience and trauma is incredibly important to talk about that. Now, psychodrama, I referenced this in a previous lecture as well, but now members are exploring decision-making through role-playing, enacting situations, and you might have the protagonist, the antagonist, and the audience, and each are offering feedback to the individuals after the experience. You might act out past experience, present experience, or anticipating life experiences to help you cope or plan what you want to do. But role playing the past, because most group therapies are present to future focused. When you role play the past, there's a purpose for it. And the purpose is to try and assign a new meaning or a new perspective on your past so that you can get a release or a catharsis. Now, psychodrama also fosters creativity within the individual, creates a sense of group and community, and builds a culture. Now, if you use a psychodramatic method, you're going to have a more active role or a director role. So the group leader is the director. So as I said, think about this as you have a protagonist who's the lead figure in the play or the movie. You have an antagonist, whoever is the source of conflict. You have the audience, and then you have the director giving guidance on how to act things out. Now, so that's psychodrama. Let's shift gears to cognitive behavioral approach. And it's important for me to impress upon you that cognitive behavioral therapy, similar to psychoanalytic perspectives, has many different branches. So if you were to think about psychoanalytic perspective, you had classic Freudian therapy, and then you had ego psychologists, you had object relations psychologists, and whatnot. Well, when we talk about what is cognitive behavioral therapy, I'm going to encourage you to refer to it as cognitive behavioral therapies with an S on it, plural. Now, I'm going to define it, then I'm going to take you on a history lesson with it. Cognitive behavioral therapy focuses on how your thoughts drive your behaviors. Thoughts impact your actions. So if I can reorganize your thoughts, if I can modify your thoughts, then your behavior will change as a function of that. Now, there's classic cognitive therapy, which just focuses on thoughts and thought work. There's classic behavioral therapy, which just focuses on do this, do that, reinforcement, punishment. Then there's first wave cognitive behavioral therapy. When we talk about Meichenbaum and Aaron Beck, these individuals, which are classic cognitive behavioral therapy, which puts them together. Then you have Albert Ellis, which is REBT, rational emotive behavioral therapy. Rational emotive behavioral therapy is considered a second wave cognitive behavioral therapy. And one of the things that's interesting is that Albert Ellis adds more of the emotions into the mix. So your actions aren't just driven by your thoughts, but they can be driven by emotions as well. And in fact, emotions can color your thoughts as well. And then there's something called third wave cognitive behavioral therapies. These are a lot of the mindfulness-based therapies. So if you've heard of dialectical behavioral therapy or acceptance and commitment therapy, many of these are considered third wave cognitive behavioral therapies. They're still in the cognitive behavioral family, but they're part of it. So now that I've given you a very quick rundown, I'm going to go into each of them. So behavioral therapy, the cornerstone of this approach is to identify specific goals at the onset of therapy and to monitor and measure progress. There is a comprehensive assessment of each individual. And then there's a series of empirically supported techniques that are used to accomplish these goals. Now, it's important for me to say this because many authors of textbooks refer to evidence-based therapy or empirically supported techniques. Of the other approaches, they're also empirically supported. So I know that evidence-based therapy has been used as a sword to attack psychoanalytic models. But if you look at work of Jonathan Shedler, they're also evidence-based or empirically supported treatments as well. So, but nevertheless, this is where it comes up in the lecture, so I'm bringing it up. All right, so behavioral therapy. So the members and the therapist collectively establish treatment goals that are concrete, measurable, and objective. You may have heard of the term SMART goals: specific, measurable, attainable, realistic, and time sensitive. SMART goals. So that comes from a behavioral approach. Leaders tend to be more active and directive. They tend to be more problem solving, saying do this, do that. From a behavioral point of view, some techniques include relaxation exercises, behavioral rehearsal, coaching, guided practice, cognitive restructuring, and systematic desensitization. Now, cognitive therapy focuses on automatic thoughts, which are knee-jerk interpretations, and cognitive restructuring, which is trying to reorganize your thoughts. So at the basis of CBT is an understanding is that we all can get things wrong. We can all draw incorrect conclusions. And sometimes we do have a tendency to have false or self-defeating thoughts that interfere with us reaching our potential. And I'll give you an example. So if you're in a group setting and a person says, you know, I'm a failure, it could be useful to be like, well, what evidence do you have that you're a failure? And then say, well, I'd like to offer some counter evidence. I don't see you the same way. And then maybe in a group setting, say, how about other people? Do you see person X this way? So you can challenge these self-defeating thoughts and attempt to develop healthier thoughts. Group leaders include or combine empathy and sensitivity with their techniques to build that relationship. They're present-centered, more psychoeducational. They tend to be more time limited, whereas psychoanalytic tends to be more long-term. And there is a use in teaching behavioral skills as well as Socratic reasoning. So asking questions to help people think about what they are thinking is useful. Now, I already talked to you about REBT, Rational Emotive Behavioral Therapy. This is Albert Ellis. So we have self-defeating thoughts, which results in these emotional disturbances or vice versa, and behavioral disorders. So correcting the dysfunctional belief from the external sources is useful. Now, so REBT practitioners unconditionally accept their members of their group and they teach them to unconditionally accept one another. That's very similar to person-centered therapy. And then REBT uses a whole host of different techniques and models. So choice theories. Choice theory, this is more William Glasser, reality therapy. So choice theory is the underlying philosophy of reality therapy. So we all have responsibility and choice. No matter how tough things are, we still have a choice in the matter. So, and everyone is motivated for change. So you're going to change when you realize a current behavior doesn't get you what you want, or you're going to change your behavior when you realize other behaviors might get you closer to what you want. So when we talk about reality therapy, the goal is to help people find better ways to meet their need for survival, love, belonging, power, freedom, and fun. So all of these basic needs people have. So there's an involvement with and concern for all the group members that's demonstrated by the group leader throughout the whole group. And you have the counseling environment and then the procedures that lead to change. So you might have heard of WDEP. So you evaluate, what do you want? What are you doing? So it all starts with what a person wants. And then you ask them, well, what are you doing? And then you evaluate that. Is what you're doing getting you closer accomplishing the goal or not? So E stands for evaluation and P stands for plan. So if you evaluate what you're doing and it's not getting you what you want and it's not getting you closer, can we work together to come up with a plan that will get you what you need? All right, so that's your cognitive behavioral therapies. Now, we also have postmodern approaches such as solution-focused brief therapy or SFBT. So the goal is to accomplish things in a very short time. The shortest group therapy that I've done was 6 sessions. But typically it's anywhere between 12 to 15 sessions. And instead of talking about problems, we want to talk about creating solutions. So it's very solution oriented, and you quickly have to shift away from the problem to a solution. Okay, what are you doing about it? What are your goals? What do you want? How do you want to change this? So you're always forcing the change or the focus on the solution rather than the problem. Solution focused therapy tends to be collaborative in nature, so the group and the group leader work together. It's very important to keep people on the solution track rather than a problem track. So you're going to shift focus. So if they revert back to the problem, you say, okay, let's put us back on track. Well, can anyone offer a suggestion or solution to address this problem? Now, so techniques used in solution-focused brief therapy, as well as other techniques, include questions about pre-therapy change. That question sounds like this. Have you done anything to address the problem between scheduling the appointment and being here today? So now you're already focusing on, hey, I could be doing something either before a session or between sessions. exception problems. Tell me what it was like before the problem emerged, and trying to draw attention to before this was an issue, how did you live your life? Miracle question. This question sounds like this. If I had a magic wand and I waved it over you and everything went the way you wanted in therapy, what would it look like? What would be changed about you? Scaling questions. So this is used a lot in motivational interviewing. So if you ask a person, you know, on a scale of 1 to 10, what's the likelihood you're going to apply for a job? And they might say 7. Oh, 7, that's really good. You know, why not a 6? So the scaling is you take their number, you ask them why not a 6 to help them think about how far along they are. And then you ask them, which is the cool part of it, what would it take you to get to an 8? So you're looking on both sides of the number and trying to guide them. You give them homework, you give them feedback. Now, narrative therapy, this occurs in journaling or storytelling. You might ask people to write a story about their life and try and make meaning of it. And each person is invited to view their story through different perspectives and co-create an alternative life story. Now, this is a cool thing. You could write the story of your life, and then I'll tell you, well, the story's not over. Write any ending to this story you want. You could write a more positive end. So narrative therapy works that way. So there is an emphasis on how societal standards were internalized and how they affected their experience. And from a narrative therapy's point of view, it could be captured by the person is not the problem is the problem. So we separate the person from the problem or the behaviors as the experience. Now, the therapist takes a position of curiosity or not knowing, in inquisitiveness. So instead of being clear, you know, that's interesting. Have you thought about this? Right? So it's very tentative. Now, motivational interviewing, this comes from Miller. Miller talked about how to guide people in growth. Now, this is an outgrowth of person-centered therapy, but it's very directive. And that's the biggest difference. Person-centered therapy is a non-directive therapy, whereas motivational interviewing is directive, but still the client becomes the frame of reference. Now, the best analogy that's given by Miller and colleagues from motivational interviewing is that it's sort of like training a horse. If you want to train a horse to do things, you got to gently guide it. Be gentle in your correction, keep moving it towards its goal, right? Slowly and with compassion. Well, motivational interviewing does the same thing. They gently provide you guidance to help you move towards your goal or exhibit positive change. We help people shift from ambivalence to an intrinsic motivation, making their own decisions. Now, practitioners who use the motivational spirit tend to establish collaborative partnerships with the members of the group. And what they do is they emphasize the team aspect and they draw ideas from the group. The group is a source of resources rather than the group leader being the expert. A phenomenological approach is applied. What this means is subjective reality is reality. We allow you to experience your narrative or your version of reality without attacking it. And motivational interviewing has found tremendous support across many different cultures. Last but not least, feminist therapy. Feminist therapy The focus on issues of diversity, sexism, and really understanding how society props up and reinforces gender issues. So, one group task in a feminist therapy might be to understand gender role, socialization. An example of gender role or gender norms might be if a kid is 3 years old and they're female, you buy them a doll and a carriage. Well, what are you suggesting there? Implicitly, at the age of 3, you're suggesting that women are meant to be caretakers to children. Maybe this person didn't want to have children. It's possible, right? But we socialize males in society very differently than females in society. Even the clothing we buy has been gendered. So if you were to ask what color to buy a baby, well, you would say, well, if you go to Babies R Us, even though I know they're out of business, and you were to buy a onesie for a girl, what color would you guess you would buy it? You would probably guess pink. And what if it's a boy? Blue. What if you don't know? Yellow, right? So there's this interesting gender typing, gender norming, and pushing gender roles on kids before they even know. And what the biggest goal of feminist therapy is empowerment, because society gives implicit messages of being secondary status if you're female. Well, empowerment is finding your voice and being equal at the table. So again, feminist therapists are more egalitarian. They work, as I said, on empowerment strategies tailored to each client. They talk about social justice. They talk about social action. They talk about power analysis. It's interesting. I'm active in many different organizations. And in one organization, at the president level, nearly 2 out of every 3 presidents have been male. Well, that says something about the distribution of power within an organization. So we have to think about this power analysis as well. All right, now let's put it all together. Going back to that concept of an integrative approach, no single theory can address every issue that's going to emerge. No single approach works for everyone. So each theory has its strengths, it has its weakness, has its own definitions and approach. But an integrative approach is blending multiple approaches together and taking the good of a given approach and leaving that which are the weaknesses. And I will tell you, as a clinician, it's very good to be trained in different approaches to therapy, because you never know when you're going to need another tool in your toolbox. If all you have is a hammer, then a lot of things are going to get broken. So learning multiple approaches to therapy is going to be a good thing. And with that, I'm going to stop the share and I'm going to stop the lesson. I thank you for indulging me. Until next time.